Oh my gosh, what a wonderful day it is to be jogging outside in the woods. Ah, what is that? Oh my goodness, it's a tick and it's bitten me. I can't believe I got bitten by a tick. Those things can be dangerous. I'm gonna mail this in to my doctor for analyzing. In the meantime, I'll use Google to help me do some research and figure out what to do. Oh my gosh, an educational video on Lyme disease. Perfect. What is Lyme disease? Lyme disease is a bacterial infection caused by a bacteria called Borrelia Burgdorferi. It is transmitted via tick bite and is the most common tick-borne infection in Canada. It affects many of the human body's organ systems, such as our nervous system, immune system, and circulatory system. How do you get Lyme disease? Borrelia burgdorferi is transmitted through ticks. There are 2 known tick species which carry the disease. Both belong to the Ixodes family. Not every single one of these ticks is a carrier, but they all have the potential to be. Did you know there are special agents in the tick saliva that allows the bacteria to survive longer in the human body? How does Lyme disease work? Stage 1. 24 to 48 hours after an infected tick bites, the infection is localized and begins to infiltrate various immune cells. The Lyme disease bacteria is incredibly fast and can outrun your own body's cells. When they are captured by the immune cells, they cause inflammation within these cells. The indistinguishable target rash may develop after 2 to 32 days. Stage 2. Disseminated infection. Within 2 days, the bacteria begins to spread to distant tissues by entering the body's network of capillaries, specifically by tricking individual cells' enzymes into assisting the bacteria. Target tissues include the cerebral spinal fluid, the retina, muscles, bones, spleen, liver, and brain. During this time, the bacteria may change its protein expression to hide from the host immune system. Stage 3. Persistent infection. Persistent bacteria may cause joint pain, mood and memory disturbance, paresthesia, which is itchy, numb, or tingling skin, and other issues depending on where the bacteria resides. All of this impairs the quality of life of the patient. How to prevent Lyme disease. Cover up. When in a wooded or grassy area, wear shoes, long pants, tucked into your socks, a long sleeve shirt, hat, and gloves. Try to stick to the trails and avoid walking through low bushes and long grass. Use insect repellent. Apply insect repellent with a 20% or higher concentration of DEET, which is a chemical used to repel insects. Parents should apply repellent to their children, avoiding hands, eyes, and mouth. Keep in mind that chemical repellents can be toxic, so follow directions carefully. Check your clothing. Check yourself, your children, and your pets for ticks. Be especially vigilant after spending time in wooded or grassy areas. Deer ticks are often no bigger than the head of a pin, so you might not discover them unless you search carefully. It is helpful to shower as soon as you come indoors. Remove the tick as soon as possible, usually with tweezers. Gently grasp the head of the tick. Do not squeeze or crush the tick, but twist off carefully and steadily. Once you've removed the entire tick, dispose of it by putting it in alcohol or flushing it down the toilet. Diagnosis of Lyme disease. The diagnosis of Lyme disease can often be very difficult, as many other diseases present similar symptoms. If there is no rash present, your doctor will ask to do a lab test called ELISA, which is an enzyme-linked immunoabsorbent assay test. This test searches for one very specific antibody which is generated in response to the Lyme disease bacteria. This test will generally be performed after a couple weeks, otherwise there is risk of a false positive. If this test does provide a positive result, it will be followed up with another test called the Western blot, which is used to confirm these results, as it is able to test for more than one antibody. Treatment of Lyme disease. Antibiotics are the only treatment available for Lyme disease, and the sooner the better is the motto. Oral antibiotics are the standard prescription. A 14 to 21 day course is common, but varies depending on age, sex, pregnancy, or breastfeeding of patient. Intravenous antibiotics are used if the disease involves the central nervous system. Your doctor may recommend a treatment with an intravenous antibiotic for 14 to 28 days. This is effective in eliminating the infection, although it may take some time for you to recover from your symptoms. Intravenous antibiotics can cause various side effects, including low white blood cell count, mild to severe diarrhea, or infections with other antibiotic resistance organisms unrelated to Lyme disease. After treatment, a small number of people still have symptoms, such as muscle aches and fatigues. The cause of these continuing symptoms is known as post-Lyme disease syndrome, and it is unknown what causes it. Treatment with more antibiotics does not seem to help, and more research is definitely needed to determine the underlying cause of these side effects.